indeed. But of course, Shivan is here and he wants to take away that stigma and talk about that stigma. Shivan, can you hear me?
Hi. Good morning, Andrew. Good morning, Zaid, and good morning to all the listeners.
Good morning.
Thank you very much for joining us, Dr. Shivan Mahabir, resident psychiatrist. Now, I mean, mental health is a serious problem, and it's something that can affect anyone. Is that correct?
That's right. It is estimated that every year, between 1 in 5 and 1 in 4 persons are affected by some sort of mental health issue. But unfortunately, it's often kept in the dark, it's kept secret, and studies have estimated that less than 50% of the persons who need help are receiving help. And one of the big factors for that is the stigma that is there against mental health and mental health issues and persons who are living with mental health issues.
Yes, Doc. First off, a pleasure speaking to you this morning. Glad to have you on. Is it Dr. Mahabir or is it Dr. Mahabir?
It's Dr. Mahabir.
Dr. Mahabir, right? Because there's always been something of pronunciation with me coming to school. I have friends with that name, the Mahabir. Now, tell me something, Doc. Mental health. We all agree that it's very important, especially now in the middle of a pandemic. Is it something that is hereditary, or is it suicidal pressures and issues that leads one to that place?
That's an excellent question. And how we view mental health illness is that it is multifactorial. So that for sure, in some cases, there are genetic components. We do see that certain illnesses seem to run in families, for instance. However, genetics alone do not account for everything. So how we look at it is that you can have the genetics, which puts you at a higher risk, but then that societal pressure or, stresses of a financial sort, relationship breakup, problems at work, that is what actually triggers it to come to the fore.
About the work environment and that sort of thing, but that basically is in your adult lifespan. Could it be diagnosed and detected at maybe an even earlier age so that it could be addressed?
Well, mental health issues can present from early childhood. There are different types of mental health issues that we see in children. So they would include things such as depression in school-age children, and sometimes that's because of a difficult family situation, bullying at school, different issues like that. But also there are some illnesses such as the autism spectrum disorders, which come on very early in life. And actually, in autism spectrum disorders, the symptoms are seen by the age of 2 years. So it's very, very early in life that you would pick up that. There are also illnesses like ADHD, attention deficit hyperactivity disorder, which often come to the fore in the school setting. So oftentimes from primary school, that is when children would be diagnosed because they can't sit still in class, they can't pay attention to the work, they're being disruptive. So oftentimes, there are a wide range of illnesses that can affect children, and they can be picked up at different points during childhood.
Coming up to 7:20 a.m. in Trinidad and Tobago, talking with Dr. Shivan Mahabir, the resident psychiatrist here at MCTV. He's also doing a show called The Present Mind, so you can look out for that coming your way. Doc, you brought up something called the autism spectrum disorder. Now, I was going to ask you a question. Can you sort of give us a range of mental health from, I guess, I don't want to say minimal, but from the least invasive, I guess, to the ones that affect persons? And is autism considered as a mental health disorder as well?
Yes, autism spectrum disorders do fall under the umbrella of mental health issues. It is listed in the Diagnostic and Statistical Manual 5, which is the main book that we use to diagnose mental illnesses. The thing about the autism spectrum disorders, the reason there's the word spectrum in it is because the symptoms vary very widely between different persons who are diagnosed with it. and also the level of functioning is quite, it could be quite different between different persons. So there's low functioning as well as very high functioning autism spectrum disorders.
And could you give us an insight on how these issues are treated?
Certainly. So when you say these issues, do you mean autism itself or these sorts
Generally, the whole spectrum of mental health. How is it in from your experience and from your knowledge addressed?
So in mental health, basically we break down our treatments into, largely speaking, pharmacological treatments or medications and psychological treatments or behavioral treatments. So, for instance, someone who has depression and has mild depression, we may choose to use counseling with that person, especially in young children. We will try to do counseling and behavioral therapy to help them to, overcome those challenges. However, if that depression was to be rated as severe, what the research has shown is that medications are then oftentimes better for those individuals. Now, certain illnesses, such as the autism spectrum disorders, there's no specific medication targeted towards that. What we use instead is a wide range of therapies, including behavioral therapy, educational therapy, family therapy. Sometimes they use non-medical treatments such as art and craft or, horse therapy. And if the person has certain symptoms such as aggression or anxiety, then for those symptoms, they would use medications to control that, but it's not to treat the autism spectrum disorder itself.
Coming up to 7:23 here in Trinidad and Tobago, talking with Dr. Shivan Mahabir, psychiatrist. Now, I wanted to ask you something, Shivan. We're going to kind of switch the focus here into mental health, stigma, and dealing with that in the workplace. Now, is there a difference between somebody who has a nervous tick, like for example, if they're in a situation where they're really nervous and their head jerks or something like that, is that connected to a mental health issue, or is that just a nervous reaction?
So one of the things about mental health is that it isn't a black and white situation. It is oftentimes a very gray area. So, for instance, you are right. There are some people who, when they become nervous, they may stammer, for instance. In a normal situation, they will not stammer or stutter. But when they are nervous, or if they have to do a presentation in front of the boss or the higher-ups, they may start to stammer and get nervous. Now, it depends on, does the person believe that this is affecting me to the point where my functioning is impaired? Because people could look at that situation and they could say, okay, I understand that this is going to happen. I'm just going to, get through it and I'll be fine the rest of the day. But other people, they take it on. They say, I'm making a fool of myself in front of the boss. I feel like I'm hampering my chances to get a promotion because they won't think that I'm, confident enough to do the work. So in that case, they may seek help to deal with that anxiety. Now, to take it a little bit further, there are disorders called tic disorders where the person has tics, mental tics or physical, verbal tics or physical tics such as shrugging the shoulder or making clicks with their mouth. And this will happen regardless of the stress that is going on. It is just like a part of their life, but it could be very embarrassing. So that can also be treated if the person, thinks that it is impairing their functioning. So we don't ever tell patients that, okay, you have A symptoms, so you have A problem. What we say is you have this issue, how badly do you think it's affecting you, and what do you think would be the best way to go forward? And then we will work with them, whether it means counseling to deal with the anxiety, medication to deal with the anxiety, to help them to overcome that issue as best we can.
Yeah, Dr.